Good afternoon. I'm Congressman George Miller, Chair of the Education and Labor Committee and co-chair of the Democratic Policy Committee. And today I'm honored to be joined with Chairman Charles Rangel of the Ways and Means Committee, Chairman Henry Waxman of the Energy and Commerce Committee, Chairman John Dingell, and our respective subcommittee chairs, Pete Stark from the Ways and Means Committee, Frank Pallone from Energy and Commerce, and Rob Anders from the Education and Labor Committee. Today marks a historic moment in America's urgent quest to fix our broken health insurance system. For the past 6 months, our three committees, the committees that have jurisdiction over health care in the House, have worked together in an unprecedented manner to develop and present a health care reform discussion draft for Congress and the American people that embodies President Obama's call for fundamental change in our health care system. President Obama asked us to draft a reform bill that will control cost, guarantee choice, and ensure quality and affordable health care coverage for all Americans. I believe that our draft lives up to those essential principles. Our discussion draft reflects months of hard work and the views of many of our colleagues. We've met with our respective Democratic and Republican committee members, with our Senate colleagues, with the CBO, with the administration, and other stakeholders in an open and collaborative process. To further this open and collaborative process, our three committees will hold hearings on this draft starting next week. After the July 4th district work period, our committees will then work to make refinements to the draft, to vote on it, and send it to the House floor. This is truly exciting news. The House decided to use this unified approach because we recognize that our ability to succeed at health care reform rests in our ability to work together. We know that inside the Beltway turf battles will not advance reform. We believe that in order to change America's health care system, Congress itself must change. When the voters elected Barack Obama president, they did not only send a message to the White House that the White House must change, they sent an equally strong message to the Congress that we must work together for the common good of our nation. They told us that we will not be rewarded for standing on the sidelines or raising every conceivable argument against taking action. Americans will judge us, and rightfully so, by our willingness and our determination to cooperate and to focus on the ultimate and necessary goal of reforming our health care system so that it works not just for a few, but for everyone in our country. That is why the approach that the three of us have taken in this process is one of the key factors that makes this year the year that we will finally fix our broken health care system. The current path of rising health care costs is unsustainable. No one disagrees with that. Health care premiums have spiraled out of control, dealing a crushing blow to families and businesses alike and placing our fiscal future in peril. President Obama is absolutely correct when he says that health care reform is essential to the health of our nation and the strength of our economy. In fact, health care reform is the single greatest tool to reduce runaway budget deficits. Our discussion draft is the first step in building a truly American solution that will reduce costs, offer real choices, and guarantee access to affordable, quality health care for all. In the coming weeks, our committee will continue to seek input from all of the stakeholders, the American people, and members of Congress. We must and we will continue to move forward. If there is one thing that is off the table, it is saying no to health care reform. There is not one child, not one worker, not one employer, nor one taxpayer who can further bear the cost of doing nothing. I am confident that we will have the ability to respond to their needs. And I'd like to thank Speaker Pelosi, Majority Leader Hoyer, the rest of our Democratic leadership, and all of our caucus and all of the members of this Congress for giving us the support and the input that we've needed to develop this uniquely American solution to finally bringing quality, affordable health care to our country.